Hi everybody, you're welcome. In this video, I wanted to talk about FDA pregnancy category classification. Drugs during pregnancy are classified into different categories based on the potential risk to the developing fetus. The classification system helps the healthcare provider assess the safety of medication during pregnancy. FDA Pregnancy Category Classification. Category A. This drug have been tested in pregnant women and had not shown any risk to the fetus during the first trimester and later trimester as well. For example, some prenatal vitamin and folic acid. Category B. Animal studies have not shown any risk to the fetus, but there are limited studies in the pregnant woman, or animal studies have shown some risk that has not been confirmed in humans. For example, penicillin, acetaminophen, and certain antihistamine. Category C. Animal studies have shown an adverse effect on the fetus, but there are no adequate studies in humans. The drug may be used and the potential benefit justify the potential risk to the fetus. For example, some antidepressants, certain blood pressure medication, and steroids. Category D. There is positive evidence of human fetal risk, but the drug may be used in life-threatening situations where no safer alternative is available. The benefit may outweigh the risk in the crucial case. For example, methotrexate and valproate. Category X. This drug have been proven to cause fetal harm and should be avoided during pregnancy. The risks to the fetus clearly outweigh any potential benefits. For example, thalidomide, isotretinoin, and some hormonal medications. It is important for pregnant women to consult with the healthcare provider before using any medication, whether prescription, over-the-counter, or herbal, to ensure the safety of both the mother and baby.